Hello again. I'm Taryn, Wellness Coordinator and host of the Reactive Health Show. I'm joined today by Marcel McDonald, physiotherapist and partner at Reactive Health. And he's joining me today to talk a little about some shoulder injuries. Hello, Marcel.
Hi, Taryn.
Thanks for coming in.
Thanks for having me.
Okay, so I'm curious, as a physiotherapist, what are some of the most common shoulder injuries that you see?
Taryn, the most common injury that I see for shoulders is that of the rotator cuff.
Mm-hmm.
So the rotator cuff consists of 4 different muscles, and they do certain movements, but their main function is to act as stabilizers.
Mm-hmm.
So the shoulder is a ball and socket joint. It's often described as a golf ball sitting on a tee.
Okay.
It's the most mobile joint in the body. So these rotator cuff muscles are very important to provide stability to the shoulder.
Right.
When they're injured, what happens is the ball part will move and it can create irritation on the tendon, and that creates the pain that people feel on the side of their arm.
Okay, so then what would you say that some of the most common risk factors are with something like this?
Some of the more common things that we see in clinic would be due to a trauma, so a fall on an outstretched arm or fall on that shoulder. Anything overhead where people are working consistently, so for example, a carpenter, painter, mechanic, hairdresser. And some of the other things that we would see are postural dysfunction. So for example, somebody has rounded shoulders. This causes lengthening of those muscles, which leads to weakness of the rotator cuff and alignment issues, and can lead to wearing of the tendons, which can cause pain over time.
Sure thing. So what were some of the most common symptoms that you would see then?
Typically what we'll see in clinic, people would describe a dull ache or a sharp pain with movement. The pain is usually on the side of the arm. Typically what people will describe is pain lifting their arm up above their head or reaching behind their back. So for example, putting on a jacket or a bra or belt, or combing your hair. Oftentimes people will describe pain laying on that shoulder or on their opposite side.
Okay. So then how can physiotherapy help?
Physiotherapy can help in a number of ways. The rotator cuff tendons are white tissue, so there's not a heck of a lot of blood supplied to the tendons.
Right.
We know that blood flow is what encourages healing of a tissue. So some of the things that we do as physiotherapists, we would use modalities such as ultrasound and interferential current that brings blood flow into the tendons. We use manual therapy to improve mobility and teach exercises to maintain that mobility, and then strengthening exercises to strengthen up the rotator cuff muscles and the muscles around the shoulder joint.
Okay. So are there a few things that somebody can be doing at home to either prevent or sort of help them if they're feeling some of these symptoms?
Definitely, and that depends on the severity of a person's pain as well. I think if you have severe pain, my recommendation would be to do an exercise called pendulars, where you let your arm hang, and you're just going to do 20 to 30 repetitions, circles one way and then the other way, and this should be pain-free, and you can do this throughout the course of the day. I would recommend the use of heat or ice, whichever feels better for you, and also to contact your family doctor or your pharmacist in terms of getting some medication to help ease the symptoms. If your pain is not as severe, there's a few things that I would recommend. As I said earlier, the rotator cuff tendons do not have a lot of blood supply, so an exercise that brings blood flow to those tendons would be having your elbow by your side and moving your arm in and out. I would do 20 to 30 repetitions of this. It should be pain-free or relatively pain-free, and if so, you can do that again throughout the course of the day. Another exercise that I would use for strengthening would be getting a TheraBand and keeping your elbow by your side. You can attach the other end to a door handle or hold it in your hand, and you're going to bring your arm out to the side. You focus on keeping your shoulder back and contracting the muscles in the back of your shoulder. You should feel a little bit of a burn, but it should not reduce your pain. I would do 10 repetitions and take a break, and then do 2 more sets over a period of time. In the case that your pain is not getting better after 3 to 4 weeks, I would contact your physiotherapist and get a more thorough evaluation and treatment plan.
All right. That's excellent information. Thank you so much for joining us today.
Yeah, thanks for having me.
Okay, great. We look forward to seeing you all again soon. Thanks for joining us.